A threat of a different kind to the safety of our food supply. The Centers for Disease Control tonight reporting at least 383 cases of salmonella poisoning from contaminated tomatoes since April. The experts are warning there could be thousands more cases not yet reported. The Food and Drug Administration tonight appears to be no closer to disclosing the origin of the outbreak. Louise Schiavone has our report.
The latest official count of salmonella poisonings, 383, all linked to tomatoes. Where are they from? The Food and Drug Administration continues to suspect Florida or Mexico, but
we may not ultimately know the farm where these came from. At this point, we're not saying we're not going to know. We're continuing to work flat out, assuming that we will get to that point. We're not pulling back.
Dr. David Atchison says Mexican authorities are now reporting suspected cases of the St. Paul strain of salmonella in parts of Mexico, the very same strain identified in the U.S. outbreak. But he warns against rushing to conclusions. The Centers for Disease Control characterizes the outbreak this way.
We have to say that it's ongoing at this point. It's really too early to call the peak, and certainly cannot say that it's over.
Consumer groups say that while the CDC's count of those infected is almost 400, the real picture is probably worse.
For every reported case of illness, there are probably 40 people who have gotten sick but haven't been reported. This is clearly a massive nationwide outbreak.
For now, the FDA can tell consumers where the safe growers are. Tomatoes grown in 39 states and parts of Florida are in the clear. Cherry, grape, and tomatoes on the vine are not suspects. Health officials and businessmen, meanwhile, say this is a good example of why it's important to label where the produce comes from.
We've indiscriminately opened our market to very unreliable suppliers. And the only viable option we have, in my view, is to move to a very detailed, very specific practice of product labeling.
But for now, lots of consumers are still in the dark because even though the FDA has defined states where bad tomatoes are not coming from, many consumers are looking at produce without knowing its origins. Well, the FDA says it's under no illusion that the government can inspect its way to food safety. For now, it's hoping that when country of origin labeling does take effect this fall, the U.S. will take a major step towards safer produce. Lou?
Well, I don't think we need the FDA telling us what they can or can't do in terms of inspecting their way to food safety. Precisely how would they propose to fulfill their charter, which is to inspect food?
Well, they're talking about hiring more inspectors.
They were what?
They're adding on more inspectors, and the more money they get from Congress, the more inspectors they'll put on.
Well, this afternoon, we had the FDA saying that this outbreak of St. Paul salmonella in Mexico was common, correct?
Yeah, they said don't jump to conclusions. It's not unusual, but
Who do these people
I'm
think
looking at a CDC press release that says that only 3 people were infected last year with this particular strain, and they used the word rarity to describe this strain early in the outbreak.
And throughout, over the course of the past 2 weeks, the FDA itself using the same expression. And now, what is wrong with these people at the FDA? I mean, are they absolutely just so excessively intellectually challenged? Are they simply lacking principle or concern for the American consumer? Because I really can't imagine anyone tolerating this level of conduct on the part of the FDA. It's astonishing. Why? Let's get to the simplest thing. Do they explain why they have not been to farms in Mexico where that outbreak has been traced, or to the businesses in Mexico where that outbreak of St. Paul strain of salmonella has been detected?
There's no explanation of that, Lou, and they say that they are exchanging information with Mexican authorities without any particular specificity. They just know that the Mexican authorities are telling them that they are now seeing the St. Paul salmonella strain.
And we still don't have a conclusion of any kind, either through the CDC or the FDA, as to whether or not there's an implication of the tomatoes grown in Central Florida. And we still have not put inspectors or had inspectors placed on farms in Mexico, correct?
They say they don't know where to send them.
How about this? I would suggest they send them to a tomato farm It'd just be a wild guess, but I might think about that. And I might also be talking with the distributors who brought these tomatoes in to the grocery stores around the country. Difficult job, as President Bush would say, hard work. But that's what everybody's paid to do, is to work hard, right?
Right.
And you have been working hard and terrifically well in reporting the story. Thank you very much, Louise Schiavone. These people aggravate, I suspect, every single American who's having to tolerate their just simple incompetence. Thank you.